Okay, we're recording.
Hi, I'm Raquel Beckett. I'll be doing my med video today. The first thing I'm going to do is I'm just going to check over my MAR, so I'm just going to make sure my orders are complete. Throughout this process, I'll be going through the 6 rights of medication. So, yep, Elsa Sutter is the right patient, taking note of her allergies. And then 2, looking at the drugs. So, we have the right medication, right dose, right route, right time, and we'll document after. So, let's check note our 8 a.m. meds. This all look good. And then 2, take note of that it says her her blood sugar is 264, so take note of that. And then we're also going to make sure we look at her PRN meds. It said she was having some abdominal cramping, which goes along with her not having a bowel movement for several days. So we're going to do that PRN and see if that helps. And then we took note of her allergies. So first I'm going to wash my hands. And I'm going to log into the MAR, or the okay, and then I'm going to type my patient's name in, comparing it to here. So Elsa Sutter, and then her birth date 3/1/1940, 3/1/1940, taking note of her allergy, penicillin. So click on that patient. Yep, this is her allergy, Elsa Sutter, penicillin. Looks good. Alright, so the first medication we're doing, and throughout this process I'll be doing kind of my safety check of right patient, medication, dose, route, time, no allergies. So the first thing we need is digoxin, 0.125 milligrams PO daily. So then we'll go up here and we will find digoxin, comparing it to our MAR, 0.125 milligrams daily. Correct. Nope, no allergy. Yes, I checked it. And then we just need one of those, comparing it to here, 0.125 milligrams, digoxin. Looks good. And then second thing we need is Coumadin, 3 milligrams PO daily, 8 a.m. Right patient, no allergies. Also known as warfarin, 3 milligrams daily. I checked her for allergies, no allergies. And then we just need one tab, comparing it to here as well. Warfarin, 3 milligrams PO daily, 8 a.m. That looks good. And then we have our MPH insulin, 10 units, U100 sub-Q BID, 8 a.m. Right patient, no allergies. So then we'll find up here NPH vial, U100, NPH vial, U100 insulin. That looks good. No allergy, right patient. And then we just need one vial, and we're comparing it to here, insulin U100, that's what we need. You have selected one insulin MPH vial, and the suggested amount is 10. Have you requested? Yep, suggested amount is 10, looks good. And then next we need regular insulin, 5 units, U100. So then we'll go up here, and then let's see here. So regular insulin, U100. Just need one. Yep. And then regular insulin, U100 vial. That looks good. No allergies. Yep, the suggested amount is 5. Have you requested the correct amount? Yep, and then we'll include the sliding scale in that. And then next we have Fluzone, 0.5 milliliters IM once at 8 a.m. And then we'll find that on here. Yep, Fluzone, 0.5 milliliters once. Looks good. Yep, no allergies. We just need one vial, comparing this to here. That's good. And then for her PRN meds that we checked before, and according to the report, we're going to give 2 capsules of Colace. So we'll go up here and find Colace, 50 milligram cap. Yep, no allergies. And then we'll need 2 of those, 50 milligrams, 2 capsules for constipation. Enter. Oh, yep, so we need 2, so we'll do 2 here. Okay, and then now, let's see, so I've gotten all of my meds I need here. Yep, digoxin, warfarin, insulin, regular vial, and then influenza, and then the Colace. So now I'm just going to press here to open my drawer. Okay, I'm going to wash my hands just before taking anything out. So the first medication we need is digoxin. It says drawer D, so we'll grab this out, and then here's my first safety check. So I'm going to compare the medication. Yep, right medication, digoxin, the dose 0.125 milligrams PO daily. Yep, digoxin 0.25 milligrams, and then daily by mouth at 8 a.m. 10, 20, 25, not expired, right patient, no allergy. Then I'm also going to compare it to here. Digoxin 0.125 milligrams, digoxin 0.125 milligrams, 10, 20, 25, so that's not expired. That looks good. I'm going to move these over so I can keep an eye on them. Put it into there, and then we'll shut that one and press here to access next item. So next we have warfarin. It's in section B. So we're going to compare that to our MAR here. Coumadin, 3 milligrams, 10, 10, 25, not expired. And then Coumadin, 3 milligrams, PO daily, 8 a.m. For Elsa Sutter, no allergies. Compare it to here. Coumadin, 3 milligram tab. That's exactly what we have here. And again, not expired, no allergies, and she's the right patient. So, let's see. I'm going to put these 2 in here because I need pre-rec assessment. And then our next one is we need our NPH vial, which is in section B. So we are going to compare NPH insulin, 10 units, U100, sub-Q BID, 8 a.m., right patient, no allergy. And then, yep, we have our NPH insulin vial, 100 U per mil, perfect. And then it is not expired. That looks good, 120, so set that onto here, and then shut this drawer. And the next thing we need is regular insulin. Press here to access next item. So, let's see. I'm not sure if I compared this one to here, so I can do that right here. So normally I would compare it right away to this. So we have our NPH insulin 100 U per mil, and so NPH insulin 100 U per mil. Normally I would do it right away. So then we have our regular insulin, 5 units, U100 sub-Q TID, 8 a.m., no allergies, right patient, and then regular insulin, 100 per mil, not expired, 120, and then just like the last one, I would compare my regular insulin. Yep, regular insulin, 100 units, and then 100 units, not expired. Perfect, just like I did for my NPH. And then we'll shut that drawer. Access next item. We have our Fluzone, and it's in section A. So I'm going to compare that to here. Fluzone. 0.5 milliliters IM once, 8 a.m., administered in the deltoids, Elsa Sutter, no allergies, and then expiration 10-10-25, vaccine 0.5 milliliter dose, that matches up there. Then we just want to make sure it matches up here. Influenza zone 0.5 milliliters, 10-10-25, not expired, right patient, no allergies, that is also correct. And then we'll shut that drawer and access our next item. Okay, so here's our PRN med and section B. So we have our Colace here. Let's see. So 2 capsules PO, PRN, BID for constipation, and then as needed, and she needs it for constipation, 10, 10, 25, and then, so that's not expired, then we'll match it up here. Doxycolase, 50 milligram capsule, and then that matches up there perfectly, 10, 10, 25. We'll put this into here, and then we need 2 of them, because right here it says 2 capsules, so of 50 milligrams, so 2 capsules PO, PRN, BID for constipation, and we're doing it at 8 a.m. Because she needs it for the right patient and no allergies for these, and 50 milligrams, 10, 10, 25, not expired, then we'll compare it to here. Colase, 50 milligram capsule, again, not expired, she needs 2 of them, we'll put them in this separate cup, and then we'll shut our drawer, and there is my first safety check, so I compared, she's always the right patient, and then I compared each medication to here, and my MAR and my med, and then along with the dose, the route, the time, and we'll document after, no allergies. So we are going to log off our med cart. Okay, so now I'm going to wash my hands first. Okay, and I'm going to roll my NPH about 10 to 20 times. 10, 11, 12, 13, 15, 16, 17, 18, 19, 20. Perfect. And I washed my hands before doing that. And then I'm gonna keep these on here actually. And then I'm going to clean this off. About for 20 seconds here. And then I'm going to make sure that it matches up here. Doing another safety check. So my NPH insulin, 10 units, U100 sub-Q BID, 8 a.m., allergy penicillin, and then I have the right patient. And then NPH insulin, 100 per mil, not expired. That all looks good. Did that one for 20 seconds there. Super clean, and I rolled it as well. Alright, and then before cleaning this one, make sure regular insulin 5 units, U100 sub-Q BID, 8 a.m. Regular insulin 100, not expired, 120, right patient, and then no allergies. And then I'm going to clean this one off as well with a different alcohol pad for about 20 seconds. $13, $14, 16, 17, 18, 19, 20. So there, those are both clean. So now I'm just gonna wash my hands one more time. I just reconcile both my meds, and another nurse is watching me do this. So here we have a 27 gauge insulin only, so that's what we need. And then I'm gonna open it away from me. Then pull out there, and then I'm just going to loosen this plunger up here, and so we need 10 units of U100, so yep, I'm going to pull this cap straight off, right there, and then I'm going to just loosen this, and then 10 units, yep, I checked that this is 10, so I'm just going to insert 10 units of air into this one, and I'm not going to touch any of the liquid. Perfect. Pull straight out. And then, according to the sliding scale, her blood sugar was 264, so according to that, we'll have 11 regular, so a total of 21. So we'll insert, there's 11, and then we'll insert the air into here, not touching the liquid, 11 units, and then we'll pull back 11, Perfect. And then pull straight out. Just don't want any bubbles in there. Perfect. So we have 11 of our regular, and now we're going to get 10 of our other NPH. We already injected the air into this one, and we rolled this previously, so then it'll be a total of 21. Perfect. Tip up. And that's exactly 21. Any bubbles? Oh, and then I'm going to put the cap on with a hard surface here. And then I'm going to, my other nurse is watching me. Perfect. I'm going to make a label right away for this one. So what we have here is NPH insulin. 10 units of 10 of U100, and then we have regular insulin of we did 11 units according to the sliding scale of U100, and then I'm going to put the date to 22/19, the time is 8 a.m., and then my initials, and then there's my label. I'm going to put it directly onto this because I just want to do that immediately, trying not to cover up the numbers. And then, so there's that one, and then my other nurse had watched me draw it up, checked with me that this is exactly 21 units is what I need. So there's that one. And then next thing we have is we're going to reconcile that we have what we need here. Your flu zone, 0.5 milliliters, IM once, 8 a.m. So this is doing part of my second safety check, which I'll do another two. Elsa Sutter, and then no allergies. This is exactly what I need. Vaccine, 0.5 milliliters, 10, 10, 25. That looks good. So we're going to take this cap. Oh, I guess I'm going to wash my hands first. I'm going to take this cap off here. Okay. And then on the sheet it said that you should shake it, but I'm just going to roll it to be safe so we get no bubbles, about 10 to 20 times there. So just don't want that. Good. That's good. And then wash my hands one more time just after touching that. And then we're going to clean it with an alcohol pad, the top of it, for about 10 to 20 seconds. So 4. And yep, not expired, no allergies, that's all good. 14, 20, that's about 20 seconds there. So then I'm going to open this. Let you see that, and just so you know, none of my equipment is expired. I checked all the boxes for the expiration date. So we need 0.5, so I'll put that 0.5, and then I'm going to snap this off, and then we're going to use our filter needle. Perfect. And then, yep, again, that's exactly how much air I need to inject. And then I'm going to pull this straight off. And then I'm going to make sure I'm not touching the liquid, and I'm going to inject my air in. And then I'm going to tip it back. make sure my needle's in the liquid. Oh, look like this might have moved on me. Okay, so there. I'm going to inject my air. Okay, and then I'm going to tip up, and then I'll pull back. I need a little more. So that's exactly what I need. Let's look back upside down, pull directly out, and then just want to get those bubbles out. Okay, and so now I'm going to use a hard surface to put this back on, and then I'm going to disregard it immediately. Okay. Then I'm going to open my other one. And then put that straight on. Okay. Yep, it's still at the correct what I need. And I'm going to make a label for it just right away. And then, so we write the medication, and then concentration, and then I'll put the date on here. The time is 8 a.m. and my initials. Do that there. And put it directly onto there, and then let's see. I just want to do my second safety check here, so reconciling that I have all the correct medications that I need for my patient before going to the bedside. So I'll do one at a time. So digoxin, 0.25 milligrams, 0.25 milligrams of digoxin, not expired, 10/20/25, PO daily, 8 a.m., no allergies, right patient, that looks good. And then, let's see. We have Coumadin, also known as warfarin, 3 milligrams, PO daily, 8 a.m., no allergies, right patient, Coumadin 3 milligrams, 10/10/25. That is correct. And then 2, for Coumadin, I just want to say that I'm having another nurse double check this with me just because it's a high alert medication. And for digoxin, I just want to say that her pulse was above 60, so we're going to be giving it today, but if it wasn't, we wouldn't give that one. And then next, I'll do my insulin. So my other nurse here is checking this with me. Yep, we have NPH 10 units U100. Yep, 10 units U100 sub-Q BID. We're checking here, 8 a.m., no allergy. Yep, this vial looks correct and it is not expired. And then we'll just also make sure we have the right documentation on our syringe. Insulin 10 units U100 sub-Q BID, 8 a.m., no allergies, right patient. Yep, 10 units U100 NPH insulin. So then we'll go to our other vial, regular insulin, 5 units U100 sub-Q BID, 8 o'clock. And then regular insulin is what we have here. And then not expired. And then regular insulin, we have 11 units of U100 according to the sliding scale, 5 plus 6, 11. And then we'll do our Fluzone here, 0.5 IM once, administered in the deltoid, Fluzone 0.5 dose, 10/10/25, that looks good. And then we'll just match this up, Fluzone 0.5, we got the date, time, no bubbles, that is correct. So I just did my second safety check here, and then, let's see, we have these last two. Colace, and so we'll do one at a time. Colace, 2 capsules, PO, PRN, BID for constipation. We're giving it because she has complaint of she needs to have a bowel movement, hasn't had one in several days, so hopefully this will help her. 50 milligrams, 10/10/25, not expired. Then we'll check our other one for the right patient, no allergies. Colace, 2 capsules, PO, PRN, BID for constipation. We're giving it at 8 a.m., 10/10/25. That's also not expired. That looks good. And then I'm just gonna wash my hands before leaving here. I'm gonna keep my meds in my sight this whole time, just so no one messes with them. I just need my med cards here. So the first thing I'm gonna do is I'm gonna knock. Come in. Hi, can I come in, Elsa? Wash my hands. Hi, Elsa. I'm your nurse. I'll be here for the rest of the day, and I'm just gonna pull this curtain for privacy here. I just have your medications here that the doctor has ordered you, and then you just want to see your bed's locked. You're in a comfortable position. You have your side rail. So let's see. I'm gonna wash my hands, and I'm gonna check your wristband here. Make sure you're the right patient. Comparing it to my MAR here. Let's see. I'm just gonna flip this ear cover up for a second. Yep, Elsa Sutter right here. 3/1/1940. 3/1/1940. So I compare it to my MAR. Everything looks exactly correct. All right, that looks good. So now I'm just gonna do my third safety check here. I'm just gonna make sure that, yep, I did, made sure I had the right patient. So now I'm going to just tell you a little bit about your medications that you'll be taking today. And then, let's see, I'm just gonna sit you up so you can take your first ones here. Okay, so here is my third safety check. So I'm going to compare them all and then I'll administer them. So we have digoxin here, 0.25 milligrams PO daily, 8 a.m. Penicillin allergy for Elsa Sutter, that's correct, and 0.125 milligrams, 10/20/25 at 8 a.m. That's good. So we'll put that into the cup. And we took your pulse. I just want to say pre-assessment, it was above 60, it was 84, so we'll be giving that to you today. And a little bit about it is it's to help control your ventricular respiration rate for your chronic AFib, for your AFib. And then side effects may be dizzy, headache, diarrhea, rash, visual disturbances. And then you'll have routine blood tests, and we'll always take your pulse before giving it. The other nurse did that for me. If it's 60 or less, we'll know and we'll contact a physician directly. So this one is not expired and it matches up perfect here with my MAR. So we'll be giving that one today. And then next we have our Coumadin, 3 milligrams PO daily. Coumadin, 3 milligrams, 10/10/25, and then 8 a.m. That looks good. Not expired. And then for this drug, we are going to check with my other RN here before administering it. It's a blood thinner anticoagulant. It helps also prevent your complications you have from AFib. Some side effects may be GI distress, so maybe some cramping, nausea, diarrhea. And then one really important thing that you need to keep note of is we'll give it to you at the same time each day, and you'll have a routine blood test. Avoid alcohol, aspirin, and make sure you report any falls if you are taking this, any injuries, anything like that right away, just because that can cause other complications with bleeding. And like I said, baseline assessment, I just cross-checked this with my other nurse, and she agreed that it matched up good, and that's what they need. Not expired, right patient, no allergy. So like I said, doing my third safety check. And so next I'm going to be doing my insulin. So I'm going to compare this here, NPH insulin, 10 units, U100, sub-Q, BID, 8 a.m., no allergies, right patient, NPH insulin, U100, Yep, this is correct, not expired. And then this all matches my chart, and another nurse watched me draw it up. Now she's watching me administer NPH insulin, 10 units, U100. It all matches here. No allergies, right patient. Then we'll just check our other one. Regular insulin, 5 units, U100, sub-Q, BID, 8 a.m., no allergies, right patient. Then we have our regular insulin, 100U, not expired. And then regular insulin, 11 units for the sliding scale. She had 6 on there of U100. And then we do have it labeled with the date, the time, and my initials. And like I said, the other nurse saw me do that one. And then a little bit about this medication is the NPH one is your intermediate acting. The regular insulin is your short acting. It's just used for your diabetes to maintain a healthy blood sugar. You might have localized redness, swelling, itching. That's more so due to improper injection technique. And then so adverse side effects could be hypoglycemia, but maybe just carry some candy if you ever notice some signs or symptoms of low blood sugar. And then we'll try and give it 30 minutes before a meal. Like I said, we'll be testing your blood sugars, report any signs or symptoms of lower high blood sugar that you might have that I mentioned to you. And then, let's see, so we did that one. And then next we'll have our influenza one. We'll compare this to the MAR again. Influenza Fluzone 0.5 milliliters, IM once, 8 o'clock, administered in the deltoid. Vaccine, flu vaccine 0.5 milliliters, dose 10-10-25, not expired, no allergy, right patient. That matches up perfect. And then we have it here too, Influenza Fluzone 0.5 milliliters, administered deltoid, 8 a.m. Yep, 8 a.m. My initials, the date, no allergies, the right patient. So, let's see. We have now our Colace. So hopefully this will help. It's used, or well, I guess we'll compare them. Yep, Colace, 2 capsules. We have 2 here. Our PRNs are in a separate cup. So we'll do one at a time. PO, PRN, BID for constipation. Not expired, no allergies, right patient. Then we'll do this one. Colace, 2 capsules, PO, PRN, BID for constipation. Yep, that's correct. 10-10-25, right time, no allergies, right patient. And then just a little bit about this one. It's used for constipation. You haven't had a bowel movement in about 3 days. Some side effects may be diarrhea, gas, cramping. And then it may impact your bowel movements. Don't take for longer than 1 week. Fluid intake, try and increase it. And then just kind of take note of your in and output, so your bowel movements and what you're taking in. There completes my 3rd safety check. I said the right patient every time, the right medication, the right dose, the right route, and right time, and then I'll document after I'm done. And then she's no allergies to any of this. So I'm going to wash my hands before administering it. Actually, I might sit you up a little more. Just I want you to be safe while taking these. Okay, I'm gonna wash my hands again. And then I'm going to give you your oral meds first. Do you want to take them all at once? She said yes. I have water here that she'll take them with. Normally I would pop these out, but for the purpose of this video and other people's use, she'll have her water, and then I'll hand them to her. They'll be popped out of here. And she'll take that one, and then she'll take this one with water. Okay, and then I'm just going to take those gloves off. And then I would throw them in the garbage here. Then, I'm going to wash my hands again, and then I'm just going to, let's see, do my first one, which is the flu zone. I'm going to put my gloves on here. And then I'm going to feel, I could put this side rail down, I guess, since I'm on this side. And then if I wanted, I could change my gloves, but I didn't touch with this hand. So feel about 2 fingers down from the chromium process, and then clean off about 2 inches or 5 centimeters. And then discard that one. And then for the purpose of this video, we'll be doing it on the injection pad. So I'll clean off about 2 inches or 5 centimeters really well. And then I'll let that air dry. And what I'm going to do is let that air dry. I'm going to pull this cap straight off. Set it there. And then, let's see, wait for it to dry here for a second. So I felt the site for palpation, any bruising, swelling, anything abnormal, everything looks good. So I'm going to inject straight in. You might feel a little pinch here, okay? Straight in, stabilize my needle. I'm going to pull back and aspirate to make sure we're in the spot we want. Yep, looks good. So now I'm going to hold here, and then I'm going to push 1 mil per 10 seconds. And then after this, I'm going to hold for 10 seconds. 1, 2, 3, 4, 6, 7, 8, 9, 10. And then I'm going to stabilize the skin and pull straight out. And then I'm going to put the safety on using this hard surface here, and then put directly into the sharps. And then I'm going to discard my gloves, wash my hands, and then I'm going to put new gloves on. Actually, lay it down. Okay, so wash my hands here, and then I'm going to put my gloves on. Okay, and then let's see. So I have your insulin shot. I'm going to clean the stomach off about 2 inches. Can I lift your gown up for just a second? And then lift their gown up, and then let's see where their belly button here, and then 2 to 5 centimeters. I don't know if I actually can clean them off, but yep, right there. And I felt for palpation, any bruising, any swelling. So discard that one, and then I'll do this on my pad here. Clean off really well. 2 inches or 5 centimeters there. Perfect. And then we'll take our thing, we'll pull it straight off, let for that to dry, and then we're gonna, just like we did on our last shot, we did a 90-degree angle, I just wanted to say, for the deltoid. And then this one, they have enough skin to do it, so we're gonna do a 90-degree angle on this one. So we're gonna stabilize the skin. We're gonna go in, like I said, because they have enough skin at a 90-degree angle. We're gonna stabilize, and then we're just gonna push it in slowly, and then we're gonna hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then stabilize the skin, pull straight out, and then we are gonna disregard it immediately. And they weren't bleeding on the deltoid one at all, but this one they're not really either, but we can apply the gauze on there if necessary or needed. They didn't need it on the deltoid, like I said, but if they did, we could. Just light pressure on that one. So then I'm going to take my gloves off. I'm going to wash my hands. I'm going to put their side rail up here. I'm going to pull your gown back down here and then give you your call light. And then you want to sit up, he said, or she said. The bed is in the lowest position. She said she wants to sit up a little. And then, let's see. Like I said, this is locked. You have the call light. And then we went over all the safety checks here. And so now I'm just gonna chart the rest. So we gave her digoxin at 8 a.m. And then we'll do the date 2/22/19. And I just want to say we did it in your deltoid too and your right lower quadrant, because I saw last time you had it done in your left, so we just want to alternate that. And then yep, we did it in the right lower abdomen. Then we did 11 units of regular U100 in the right lower. And I'll just sign here. Okay, and then we have our 8 a.m. And this was 0.5 milliliters. And then we did this intramuscular in the deltoid. And then we'll sign our colace off, 8 a.m. And then we did that milligrams or 2 capsules, and then that was PO, and then signing my name here. Okay. And then I also just want to sign my name here. Yep, so now I've completed my documentation fully. I've made sure that the patient is in a comfortable position. I'll be back in about 15 to 30 minutes to check on you. You let me know if you notice any signs or symptoms before. You can call me if you need. Thank you. And then the documentation.
Okay.
And then I signed my name. And then, so I did the date, or I did the time, the date, the route, the concentration for each, and that's